Okay, so even though I think most people are like most concerned about meds, I do want to talk about just like the endocrine system as a whole, just for medsurg, and because it's a complicated system. To me, it's a lot harder than like psych or something like that. But basically, endocrine glands, which control the endocrine system, are glands that release hormones straight into the bloodstream. They're not ducts; they're direct messengers, and they're sort of like your body texting other parts of your body, like, "Hey, you should chill out." Like, "Hey, you should, probably eat something." Like, "Hey, like, you're really stressed out." Um, that sort of thing. Like, "Hey, you should ovulate." That sort of thing. It's telling your body different sorts of things depending on what hormone it is, depending on what system you're talking about, because there are so many hormones, and each gland has its own hormone. So the hypothalamus and the pituitary work together, right? We know which one the master gland is because we've been pop quizzed on it. But I like to kind of think of the hypothalamus as like the CEO who runs the entire system, and like the pituitary as sort of like his bitch, right? So like hypothalamus like tells the pituitary what to do, and then the pituitary bosses the whole workplace around. And when things get too high or low, the body's natural response is to release hormones, via a negative or positive feedback loop in order to maintain homeostasis. But obviously that doesn't always work, especially as we age, if we're predisposed to certain conditions, sort of thing. And like I said, each gland has its own specialty. So like, for example, the thyroid makes like T3, T4, pancreas, insulin. The gonads make, sex hormones, that sort of thing. The physical signs of endocrine disorders are often pretty physically noticeable, right? So if you're talking about something like super obvious, like Cushing's disease, like where they look like the Hunchback of Notre Dame with a moon face, like, yeah, that's real obvious. They're not always quite that blatant, but somebody's endocrine system is off. Not always, right? But a lot of the times there are physical manifestations that are hard to ignore, especially like just generally looking not great. Or if you have, some people have bulging eyes, which is never a good look, hair loss, dry skin. Your physical body will show pretty often if something is off hormonally, because that is the basis for its homeostasis. Blood tests, if you are, exhibiting some of these symptoms or think that you might be, blood tests can confirm it. It's not like a rule out type of thing, typically. But things like TSH or glucose tests or imaging, like for like a pituitary mass or something like that, that will show in imaging and will give, how would you say, clinical corroboration to the physical symptoms that you're experiencing, or that one is experiencing, rather. And shit. I think for the overview, that's pretty much good. I kind of just wanted to like talk about it as a system because it's complicated, and like there's so many different hormones and they control so many different things. Like this would be like a 30-minute video if I went through all of them. But I don't expect anyone to watch these. These are kind of like for my learning process. But if you do, sick. I guess I should talk about nursing considerations for these types of patients, right? So like, what do nurses do for people under their care with endocrine disorders? So basically, it's mostly patient education and medical management, depending on what it is, because a lot of these endocrine disorders get worse with age, especially like thyroid function, right? So you want to make sure that you are explaining the importance of maintaining their medication regimen, the importance of if they need to be on any sort of like specific diet, basically just patient education about the disease, the biggest thing that you can do. Make sure that they're following up with the provider, that sort of thing. Yeah, okay. I think I'm going to try and study for a couple of hours, but this helped me clear my mind a little bit. I feel like I'm a little clearer on the subject.